everybody. We are ToRAISE Questions Doula podcast. This is Melanie Headley. I'm here with ToRAISE Hakoon. ToRAISE is the executive director of ToLabor, which is an international doula training and certifying program.
Hi.
Hi, ToRAISE.
Hey, Melanie. And Melanie, your job are many, but you are a doula.
Yes.
A certified professional doula with ToLabor. You're a childbirth educator.
Yes.
And you also
Lactation counselor.
are a lactation counselor.
My business is A Brighter Birth, if you guys want to check it out.
Yep.
abrighterbirth.com.
And a mom of 4 kids.
Yes.
And a wife.
And I work in a hospital during the day.
That's right.
With centering pregnancy.
Yeah. So very full, many qualifications to be sitting here, and also a trained instructor for ToLabor as well to teach workshops. So I'm glad you're here with me.
I'm waiting for all those Italian workshops to open up.
Yeah. My son is off to Italy in October, one of my kids, and on a tour for his film. And I'm so jealous.
Oh, that's great.
I know. I just want to go, but his girlfriend's going with him.
I say just show up.
Yeah.
Just show up.
I'll just be teaching. I would actually, I know I would have been more than welcome, but I'm teaching workshops during that period of time. But yeah, Italy is where I want to go. So you out there who are listening with the Italian connections, we'd love to do a workshop there or anywhere. I mean, we got a really nice inquiry from somebody in Amsterdam the other day, and it was like, well, we'll go to Amsterdam and teach a workshop. Fun. Yep, not a problem. So you doing okay?
Yeah, I'm doing great now.
Summer's over.
School is back in session.
Yeah.
Yes.
Yeah. All your kids are in school.
Yes. I have a kindergartner this year.
Yeah, and a 7th grader, right? Sixth.
So he went to middle school.
Middle school, right.
Yep.
Yeah. See, I'm still back in the days of my childhood when 7th grade was that
was
period.
Me too.
Yeah. Well, good. So what's happening today?
So, well, first, we would like to thank you all. We started talking about donations last week, and we have received some really generous donations. Thanks, guys.
I know. Thank you so much, everyone. We really appreciate it. And like we said that day, every little bit really helps us and just continues to keep supporting us in this work that we're doing. So if you can consider donating again, and Melanie, and
it's easy. It's really easy. So you just go onto our homepage, ToLabor.com, and on the homepage on the left-hand side, where you see all of the options to click through our site, at the very bottom is a button that says donate. And just click on that. And if you don't see it for whatever reason, keep scrolling and you'll see the picture of our podcast come up and it says donate to the ToRAISE Questions Doula podcast.
Yeah. And we really appreciate it. And also, again, subscribe to us on iTunes, leave a review, rate us, but also write something about us in a positive way, I hope. I think so. And
please.
Yeah, it just really helps us have a greater presence on that whole podcast field. So Thanks, everyone.
Thank you. And today we are really excited. We have a guest coming. I'm so excited to just hear.
Yeah, me too. I don't want to do
it. About her services.
Me too.
So today our guest is going to be Lynn Shulte-Leech. She's a physical therapist who specializes in women's health. She's got over 25 years of practice, and within there she combines physical therapy with craniosacral therapy, visceral manipulation, and holistic pelvic care, which is all across the board fascinating.
Right.
She's considered a pregnancy and postpartum recovery expert, helping women to have a smoother birth and a faster recovery. And you can go to her website, and her business is Intuitive Hands, and her website is intuitivehandspt.com. She's got lots of information.
And videos. Yeah, so we look forward to...
webinars coming up, all sorts of things.
Talking to her and listening. So stay tuned.
Stay with us. Here we are with our guest, Lynn Shulte-Leech.
Hi, Lynn.
Hello.
Hi.
I am. Hi.
Yay.
Hi, welcome.
Thank you so much. I'm so excited to be able to share what I know with everybody that's listening in. So thank you for this opportunity.
Oh,
I really appreciate it.
We're so glad, Lynn, and we appreciate you taking time out of your busy day to do this. Lynn is as we already mentioned, a physical therapist, among other things, in energy work, which we mentioned earlier. And you're in the Boulder, Colorado area? Is that correct?
Yes, I am. I have a clinic in Boulder, and then I also go down to Denver twice a month.
Great. And we gave out your website before, and we will do it again at the end so that people will be able to take a look at what you offer, not just in your community, but online. It's got so much helpful information. But, one of the first things I just want to say to you is looking at your website, one of the things I really, really love is on your homepage, your diagram of the pelvic floor anatomy as the front page. I just love it. It's just so perfect to me that there it is. There's the vagina.
Right.
There's the urethra. I just thought this woman cuts to the chase, and I just thought it was such a great way to start the website. So thanks.
Oh, well, thank you. Yeah, no, I think that pops up depending on what blog post is up at the top there. So, yeah, I have to laugh because I work in this area all the time, and I'm just so comfortable with it.
Sure.
Like I'll put my hand right on someone's pubic bone, and I don't think anything of it. And some people are like, and I'm like, oh, yeah, I got to kind of remember that not everybody is so
comfortable
attuned and so familiar and comfortable with this area. So.
Exactly. Well, and I know that as having done births for 20 plus years, that I'm very comfortable with the vagina. I'm very comfortable with breasts. I'm comfortable with women's bodies entirely. And I forget the same thing sometimes, like people are just, they're like uncomfortable in front of me. I'm like, I'm totally okay with this. Yeah. But I know that they're not necessarily comfortable, but I'm comfortable. I just want them to be. Anyway, right. I wanted to get you started about talking. You have so much information to share, and we really want to encourage listeners to go to your website to look at it. But one of the things that drew me to wanting to talk to you specifically, and so I'm just going to start you there, is about managing pelvic floor tone for births, and what you mean by that. So what do you mean by that?
Well, thank you. Yes, this is so important. The pelvic floor muscles, to me, are the gateway for the baby coming out, I feel.
Sure.
Anyway. And I've seen it in my work with women. I liken the pelvic floor muscles to like a stoplight for a baby coming on out. And when women are carrying too much tone in their pelvic floor muscles, by that I mean that their muscles are so tight. And let me give you an analogy. Have you guys ever found yourselves where your shoulders are up by your ears?
Yep.
Right?
Yes.
You're just doing, right? So everybody knows that tension, like, whoa, and then you become aware of it and you go, oh, wait, why are my shoulders up there like that?
Isn't it crazy?
Yeah.
Yeah, there's an energetic pattern there. There's a core pattern that's happening. Sometimes you'll only find your right shoulder up, or maybe you'll find your left, or maybe you'll find both. And that same exact tension happens in the pelvic floor muscles as well. And so we can have increased tension, meaning the muscles are already partially contracted, whether it's actively or passively, without our awareness. And so for me, that if a woman has red light tone in there, that means her pelvic floor muscles are walking around with her shoulders up in her ears. There's that much tension in there, and that red light tone is saying, "Baby, you're not coming out this way."
Yeah. Okay.
We can have red light tone on one side or both sides, or either or both sides. And then there's yellow light tone, which is kind of like there's some tension in there, but they give a little bit. There's a little bit of springiness to them. And then there's green light tone, which is like the muscles give and they bounce and they're springy, and that's what we want for a better birth, an easier birth. So
can I just ask you a question then?
Yeah.
Okay, so is that the tone when somebody is pregnant or not pregnant?
Oh, it's common. If you have these patterns before you got pregnant, you'll carry them into your pregnancy.
Well, how does relaxin, the hormone, I thought it loosened, our muscles and so many of our joints. And does that not impact it in some way?
Not necessarily the muscle tone.
Okay.
If there is if you have a core pattern, which, talking about the energetics here, we're talking about a space where a lot of women have been, they've kind of abandoned the space. If there was any form of abuse or, maybe they, got taken advantage of or, sexual abuse, there's tension, there's holding that's subconscious, and it's a safety thing. And those muscles will stay tight, and the relaxin, which causes the joints and muscles and the ligaments to relax and open up, the muscles still maintain that tension. And so this is the key for, I worked with a doula who had given birth with her first child. She tried to do a home birth. She could only get to 4 centimeters, and then she had to go to the hospital to get an epidural. And after she got the epidural, then she was able to have a vaginal birth. Now, she was pregnant with her second one when she came to see me, and her pelvic floor muscles won the award for the tightest pelvic floor muscles I've ever worked with. And, I pride myself in really being able to help women release their patterns in 1, maybe 2 sessions, and it took us 3 or 4 sessions to get her muscles to relax. So there was just such a core tension pattern of her holding those muscles that it took an epidural to get them to relax, to get that baby out. Now, after she worked with me, the second baby came right out. She was able to have a home birth with her second.
And so besides women, besides women who have experienced abuse before in their past, do you see this pattern happening? Are some women just more predisposed to having stronger pelvic floor muscles?
Yeah, see, the problem is, the problem in our society is that women don't really know what's going on in their pelvic floor muscles.
I think you're right.
So, yes, so women who have been abused or have that history of sexual trauma, they may or may not. Who knows? It depends on how, if they process that or not, or, where they're really at in their healing process.
Right.
Whether or not they'll have tension in their muscles or not. Who knows? And so my focus, I would love the perineal massage. You know how we encourage women to do perineal massage? I would really love the focus to be more on the muscles.
Okay.
Instead of just the skin and the opening there.
Okay.
Because my feeling is if the muscles are springy and can really open up and expand, the tissue's going to follow. If the muscles are tight, the skin's going to stay tight too. Does that make sense?
Yeah. But can I just ask you again, because to clarify, we understand that potentially you could or could not have tight pelvic floor muscles because of abuse in your history. But can a woman who has not had abuse in her history can also have tight muscle tone?
Totally. Yes.
And
yes,
are
exactly.
there reasons, like, for instance, recently we were asked a question by some listeners to actually ask this question, that they were working with a dancer. One was working with a dancer, one was working with a yoga instructor, who both attributed their first births, they had cesareans, and their births, they couldn't get the baby to come down, and they attributed tight potential pelvic floor muscles as a result of that, and they were trying to figure out, was it related to their livelihood, and what could they do for this pregnancy that would help maybe avoid having another cesarean.
Yeah. See, I totally understand that. So women, the lifestyles and the activities that we do, women who are athletes and dancers and Pilates instructors who are always taught to tighten, kegel, they're in this holding pattern. And so their pelvic floor muscles or their shoulders are up to their ears, right?
Okay.
And what what we need to help women understand is that, and another thing I'd like to dispel is this theory that we have to be doing thousands of Kegels during pregnancy. And if you think about it, when we tighten our pelvic floor muscles, the pelvic floor muscles attach from our sacrum and tailbone in the back and come forward to the pubic bone in front. And if we're constantly tightening those, we're bringing that sacrum forward even more and more. And then we spend most of our day sitting on that sacrum, putting pressure forward. And what needs to happen for birth? But the exact opposite of that. So the sacrum has to move backwards.
So it's so interesting to me because you're not the first person. And I'm going to be totally transparent with this. I have always been. I am a mother of 6 kids who are now all grown-ups. My youngest is 24, and I had wonderful birth experiences. And I also have been not a religious Kegeler, but I've done them and I promote them, and I think that they have served me really well. I'm almost 58, and I have to say that part of my body is working really, really well. But I have read, and you are one of the people as well who has said, the opposite about doing Kegels and doing Kegels. And there's a resistance in me, to be perfectly honest about that. Not because it's just so different than what I was, originally taught by, for instance, my midwife of almost 33 years ago. So explain again why Kegels, I understand what you said. I think our listeners do about what you said, how it brings the sacrum, but is there a time and a place to do Kegels?
Yeah. So the thing is, out in the medical world, the practitioners if you have any problem down in this pelvic area, they're like, oh, Kegels, do Kegels, do Kegels. That's their only answer. Their only
I agree.
Solution to any problem down that. So, but the problem is that we don't know what the state of those pelvic floor muscles are actually in. The women that I see in my clinic, their muscles are already too strong. They need to work on relaxation. And I know many other women's health physical therapists would agree with that. That if a woman has increased tone in her muscles, doing more contractions is actually going to make it have her have a harder birth. That's your dancers, that's your Pilates instructors, that's, so, but then, so I guess I've never really met a woman who's had too much weakness in her pelvic floor. That's rare, I think.
See, that's interesting.
I'm seeing.
Really, because, again, I've heard practitioners who I do respect, who spend a lot of time with their hand in the pelvis, in the vagina, up in that area, who have knowledge, who will say a lot of times that their pelvic floor muscles are shot from having other babies. And I've been at those births where the mom has had a really hard time pushing those babies out because there was nothing to support those pelvic floor. There wasn't a good amount of support. They were shot to hell.
And you find that more in subsequent
births
pregnancies.
Is what I have seen. So it's kind of like we're talking, I feel like we're talking the opposite.
Well, okay, so here's the thing. I'm talking about first births. Okay, so first pregnancies.
Okay.
When we're telling those mamas and they're going to those birth classes, and the birth classes are saying, you need to do 1,000 of Kegels a day,
I don't say that.
Keep strong. Now, okay, good. Good. But here's the thing is that, what I wish we would say instead is, what are your pelvic floor muscles doing? Here is how you can assess. Put your finger in your vaginal opening.
Oh,
and
that's
I
great.
like actually using a thumb. And if you put your thumb in and it's pointed down, and if you just let it rest, like if it's a clock at 6 o'clock, you're right on your rectum, okay? So you don't really want to push right on your rectum, because if you have any stool in there, that might feel a little uncomfortable. But if you just slide over to the left or the right, you're on muscles there. And so then I instruct my mamas to push down on that and see if it springs. It should spring like you're pushing down on a trampoline. And if it doesn't, then we've got too much tone. And it should be the same on both sides. So instead of just focusing in on the perineum and the skin, that's what I would have my mama do initially, okay? So we're talking about two separate problems. Okay. We're kind of mixing so I want to clarify.
I'm glad we're clarifying.
This is for pregnancy women, right?
And first time specifically.
We're not even there yet, because that's a whole nother story. I'm just let's talk about the mama who's never given birth before. Okay? So these first births where, we're hoping for a vaginal birth, and yet we're not checking out the door to see if it'll open. Okay? Another analogy that I have with the whole birth and the pelvis is it's like a doggy door. Those doggy doors that swing from the top?
Right.
The pelvis, so the door is the sacrum. The hinges of that door are the sacroiliac joint. And then the floor that doggy door can swing across are our pelvic floor muscles.
Okay.
So if we have too much tension and there's too much, rocks in front of the door, that sacrum's not going to be able to move backwards and open up.
Okay.
If the hinges, if there's a problem going on in the sacroiliac joint, that's going to create the sacrum not to be able to open up. A lot of the hinge work comes, problems in the sacroiliac joint come from having too much tension in the pelvic floor muscles on one side. Okay? So so if any of your new mamas are having low back pain during pregnancy, that is an indicator that the mechanics of her pelvis may not work properly.
Interesting. Okay.
Most doctors just say, well, that's a normal effect of being pregnant.
Exactly. Right.
I'm here to say that could be a dysfunction happening in your pelvis that might not allow it to open up during birth. We don't know. But let's get inside and see what your pelvic floor muscles are doing. Is the muscles tighter on the side that you're having the back pain? If it is, there's a correlation.
And so the pregnant person themselves can check themselves to get an idea of this, correct?
They can, yes.
Okay.
And so when you put your thumb vaginally, you put your thumb into your vagina, and if you go off to 5 o'clock and 7 o'clock are the two muscles. So from 3 to 5 o'clock are muscles, and then from 7 to 9 are muscles. If you just put your thumb in there and you press down kind of a little bit diagonally, you'll see if it gives or not. And if you don't know if you're on muscle or not, do a Kegel, and the muscle will pop right up into your thumb if there's activity in that muscle, okay? And yes, we do want to have tone in the pelvic floor muscles. We do want them to have some strength, because the baby's head, once the baby's head hits the pelvic floor muscles, then it knows to rotate.
Exactly. Right. And that's where I've seen the problem.
Right. And so, but my thing is that if the baby's not coming down in and not engaging into the pelvis, a lot of times there's too much tension in the pelvic floor muscles, not allowing that.
Okay.
This is a story I had. A gal came to see me. Her baby's head was headed into her left hip. And, I could feel it. It wasn't midline. It wasn't in the middle. It was off. It was, if she started labor, she was going to be pushing that baby out her left hip.
Okay.
And I worked on her and did some internal muscle work, and her right side pelvic floor muscles were too tight. Mm-hmm. And when we released that and she got up, the baby's head moved midline. So I see that the baby's head kind of goes away from the side of tension.
And so how would you release that?
Well, it took you've got to really be able to, if you can feel that tension in your, using your thumb, and you feel that tension in there, you can try breathing into that muscle. You can try to, push on it a little bit and just see if it will relax and let go. When you put tension and pressure on that muscle, it can melt like butter underneath your finger.
Okay.
Okay? And that's a muscle giving way. I take my work with the women that I work with a lot deeper, and I really focus in on, okay, why is that muscle tighter?
Right.
And there's different parts of the bowl mean different things. I go deep into, we go into the emotions, we go into the pattern, the core pattern, and why and that's a whole nother discussion here.
So
let's just focus in on the pelvic floor. But
possibly if they're not in your, obviously those who are listening from the Denver, Boulder, that whole surrounding area, they have the possibility of, setting up an appointment and go see you as a potential. But it could be recommended then, from what you're saying, that they can try to assess this themselves. They can try and work on this themselves. But another really good suggestion would be to find a physical therapist who works specifically in women's health in the pelvic area. Right. Go ahead. Yeah.
Yes. Yeah. A women's health physical therapist can do internal work and help you release your pelvic floor muscles.
Right.
Now, I just want to give a warning that they will not, it's against our guidelines to do internal work during pregnancy.
Okay.
They just don't like women going in there. So, I would encourage you to do it yourself.
Right.
I have done the internal work during pregnancy because I realize the importance of really allowing that to open up so the baby can come out. So I feel comfortable doing it myself, but
gotcha.
Not every practitioner will.
And
so I just want to kind of throw that out there.
Well, that's good to know.
Move on.
Yes, please. Let me just one more question just for clarification. So just to be clear, it sounds like to me, and maybe I'm misinterpreting this, that those pelvic floor muscles needing to be loose has a lot to do with the descent of the baby.
The pelvic floor muscles need to be released for the descent of the baby.
Yes.
Is that what you said?
Yes. Is that correct?
I find that there is a correlation between those two.
Yeah.
So if a baby is not descending,
right, and
you've checked your pelvic floor muscles and the muscles are nice and springy and bouncy on both sides, then I would really look at a positioning issue with the baby.
Yes, yeah, definitely. Right. We know, we've talked about that a lot. But so they need they need pelvic floor muscles to have strength to be able to help that baby rotate and be pushed out. But if
in the ideal position.
In the ideal position.
Right.
But if they're too tight, that could prevent the baby from descending, is what I'm hearing.
Yes, and I want to make something clear, because the way I'm interpreting what you're saying there is that you need the pelvic floor muscles to push a baby out, and that's not true. When you're pushing a baby out, see, the thing is, what we need to understand is the pelvic floor muscles and your transverse or your lower abdominal muscles work together. Like if you try to just tighten your stomach really tight, you'll find your pelvic floor muscle kick in. If you try to do a Kegel really tight, you'll feel your abdomen kick in.
Right.
Does that make sense?
Right.
Okay.
Okay.
So they're wired together.
Gotcha.
Okay? So they're wired together. In labor, when we're pushing, we need to disconnect them.
Gotcha.
Okay?
Mm-hmm.
Because when we're engaging our transverse, we need to relax our pelvic floor muscles. So our pelvic floor muscles are not responsible for pushing a baby out.
Right.
I want to make that clear.
Yeah, I get it.
Okay.
Right. It's more, I get it. And I think our listeners do too. So I appreciate, go on to what you wanted to say next.
Well, I want to go on to post-baby now, pelvic floor muscles post-baby.
Yeah, I think that's important.
That a little more. Okay?
Yep.
Because that's a whole nother ballgame that will totally affect your second pregnancy now, okay? Because what happened in the first birth is totally going to affect your pregnancy the second time around. So here's what happens after a baby's born. The pelvis has to open up really wide to get the baby out. The pelvic floor muscles have to stretch, and they're kind of twisted because that baby's head has to rotate in there, right?
Right.
And after you have a baby, because of that twisting and stretching out, and depending on how that baby came out, there are going to be certain muscle fibers in that pelvic floor that are not going to be able to activate. They're just shot. They got tweaked, and they're in no amount of Kegels is going to be able to untweak it or to get it to activate again. And so that's where I want to help women understand that if they've been doing Kegels and till they're blue in the face and they're still not getting any stronger, it's because their muscles need help.
Okay.
We need to kind of massage those muscles a little bit, kind of like rub them down a bit and help them to come back together again. Because another huge piece for healing your pelvic floor muscles after birth is we need to clear out the shock and trauma that your pelvis, I find this a lot, is the pelvis sometimes remains stuck in this birthing pattern.
Right. I can imagine.
It makes sense.
If any point during that birth, that mama says, time out, I'm done, I can't get this baby, I can't do this anymore, I'm done, forget this, that's a trauma response in the body because we can't run away from it and we can't fight it, so we freeze.
Right.
And that's the trauma response. And so many women I have worked with
say exactly that.
Yeah.
And
so
feel that. I mean, I think that what you're saying is when a woman says that, there are so many women that I have worked with, that we have worked with, that say at a certain point during their labor, I just can't do this anymore. I just can't do it. So if that's a trauma potential that's now in their body, I would say 50% of women have that trauma in their body. That's I
would agree.
Yeah, moderate estimate there.
Yes.
So,
I first discovered this when I worked with my aunt who has a 47-year-old son. Now, her 47-year-old son was a very traumatic birth for her, and her pelvis. So I tune in energetically to what the tissues want to do. So I've been able to sense in women's bodies what's happened as that baby came out. And so I was very shocked to find that, oh my gosh, this right side really got more pressure, more trauma than the left side. And I was finding, I would just think babies come out right in the middle, but it doesn't. And so one side of the body would get hammered more, and I hate to say it that way, but more pressure, more tension as the baby came out than the other side. And then I started tuning in and feeling the sacrum, and energetically the sacrum's still pushing backwards. Their sit bones are still splaying out to the side. And that's a birth pattern. And that's happening on an energetic level. So, a doctor doesn't understand this. Most physical therapists don't understand this because they're not dealing with the body on an energetic level.
Gotcha.
And yet, if those bones are still splayed out to the side and the sacrum is still going back, your pelvic floor muscles are on tension. They're strained, okay? And now they can't relax and come back together, and now you're saying Kegel, Kegel, Kegel. It's like they're a tightrope, and you're trying to make the tightrope activate and contract, and it can't.
So it sounds yeah, go ahead. I'm sorry. Finish.
No, go ahead.
Nope, go ahead.
Oh, well, I just had one client that came to me, and this is a huge issue for pain with intercourse. I had this mama come to me, and normally when I do my internal work, the opening is like a round circle, right? Well, when I worked with her, it was tight. It was a tightrope from 3 to 9 o'clock. And so I just knew that her tissues were being stretched apart, creating this tension, and she was having pain with intercourse, and she tore just a little bit, and her doctor's like, oh, you've got scar tissue in there. And when I felt that 3 to 9 o'clock being like a tightrope, I just helped the tissues, and it's so easy to do if we can just kind of help the body realize that the labor's over and baby's out, and I just gently help the ischial bones, the two sit bones that we sit on, kind of squeeze them back together a little bit. And the tissue softened, and it wasn't a tightrope anymore. And then she had full contraction ability of her muscles, and then intercourse wasn't painful anymore.
Well, yeah, go ahead again.
Yeah. And then a whole other, and I'm talking about concepts that I'm not quite sure, and I really wish there were a way that I could, help people long distance with this, because what I'm also finding with the pelvic floor muscles after birth is that the bladder gets squished off to the left-hand side as the baby comes out, because I think the larger, in ideal situation, the larger part of the baby's head comes through on the left side of a woman's body.
Ideally, yes.
And ideally, right? And so the bladder gets smushed off on the left-hand side. So when I'm doing internal work, and I just put my index finger, I don't use a speculum or anything, I just use a glove finger. And when I feel the bladder, there's less space on the left-hand side than there is the right-hand side. And that tells me that the bladder is squished down. And then that can kink, or it puts a dysfunction in the internal sphincter where the bladder neck and the bladder connect, the urethra and the bladder connect there. There's a sphincter there, and it creates a tension on that. It doesn't allow that sphincter to close fully. So when I'm able to bring the bladder back to its midline position and release the tension in that sphincter muscle, women no longer leak.
Because that's what I was going to say. So Kegels, again, are recommended for that, but you're saying the release of the muscle there could actually be what's needed.
And getting the bladder more realigned.
Well, right. When the bladder, so here's what I found. So when I do an internal assessment of people, I check their muscles, and I have them contract on the left. I'm assessing their left side, I assess their right side, and then I just kind of press around a little bit and say, is any of that sore? And a lot of times, women will say, yes, oh, that's tender, ow, ow, ow. I won't touch them, okay? I'll go right up to the bladder, and I'll get the bladder back into its midline. I call it their happy place, the bladder's happy place. And then I go back down and check the muscles. Now the muscles are normal. They're not tender anymore.
Wow.
So what I'm seeing is that the bladder being in an unhappy place in there is activating these pelvic floor muscles. So I wish there was a way to help everyone learn how to get their bladders back into the normal position there, so their muscles will relax, so they can then contract them and get them strong. Because there is, birth does make them weak. So I am a big proponent. We have to do Kegels afterwards. But if your muscles, doing Kegels without doing any work to the tissues is only going to strengthen the fibers that can contract.
Gotcha. So, Lynn, I just realized that you are beyond a wealth of information, and I haven't even gotten to some of the other questions I wanted to ask you. And we are starting to run out of time. So what I'm wondering is if we could, do this again and talk some more about some of the other really important issues that women go through. Yeah, with because childbirth, the big thing out there. One of the things and we can't talk about right now, but if you've been doing this work for 25 years or so, that the change also in our lifestyles and also how birth is being done to women and the different choices of the birth options out there, how that may or may not impact also the pelvic floor integrity and also the whole structure of the pelvis and the, what do you call it? The diastasis? Is that how you say it? Recti? That's another whole conversation. So I think what we need to do is kind of leave people with this right now. We'd like to encourage people to go to your website. Can you tell us your website again, please?
Yes, it is Intuitive Hands with an S, PT.com. So intuitivehandspt.com, and that's for physical therapy.
Right. And
that's what the P and the T are.
And it's a great website to begin with. I mean, you've got so many topics up there that you've written really well about, and some videos, and then people can also get some videos to view as well. But it'll give our listeners some information immediately that will clarify again what you were talking about, going into more detail about how to check your pelvic floor muscles. I think it's one of those things that when I'm listening to you that I think, damn it, this should just be common knowledge, not something that you hear hear about, I mean, it should be through obstetrical care and it should be through midwifery care. And, not to say that there aren't, there are good OBs out there and good midwives out there who do know this information and do include this with their clients, but it's so far and few between that I'm really appreciative of you willing to share this with us. And I think what we'll do, Lynn, is just have a part 2 and maybe a part 3 to continue the conversation.
I would love that. I am so passionate about this.
I can tell.
Really helping women because can you tell, you guys?
Yeah. No, you sound like us when we're talking about certain things too. So totally get it.
Yes. Yeah. It's so wonderful though to just know that. I just want women to know that there are options out there for them. They do not have to live with, leaking for the rest of their life.
Absolutely.
And surgery is the only option the doctors give them.
Exactly.
Or let's do surgery.
Exactly.
And I'm like, no, there's so much more, and there's so many more topics. And I do have a lot of articles written on my website. I also have 3 videos that I sell on there. There's a How to Lose the Pooch for Good, which is all about diastasis, healing diastasis recti. And then there is a How to Have an Easier Birth and a Faster Recovery video that talks a lot about the different things that a woman can do to help prepare her body for a better birth.
Right.
And then, she'll recover much quicker, right, if we don't have as traumatic of a birth.
Right.
And then there's also a whole postpartum care video of how to take care of your body after you've had a baby. And so I would really appreciate even you doulas out there, if you could get those and just listen to those. You are the first line of offense.
Well, that's why we invited you. Exactly. So they are the they help educate and let the women know what their options and choices are, and they want them to have the safest and healthiest birth possible. So this just fits right up their, this just goes into their tool bag of information. So
and it sounds like Boulder and Denver are extremely lucky to have you as a resource.
Oh,
and
thank you.
And you are going to need to figure out some sort of web consulting company going on here.
Yeah. Well, and I do want to say though that I can do, because I can tap in energetically with what's going on. So I've been working long distance with women, clearing the trauma from their pelvic bowl so that women can reconnect back down in there.
Well,
and
good.
That's what I found. Yeah. So
then
do that long distance.
Then we appreciate you being with us, Lynn. We will be in touch. And listeners, thank you. You'll hear be sure that you do listen to, go on Lynn's website, take a look at all the information, maybe get the videos, and we'll talk again. So thank you. Have a great day out there in Colorado, and we'll be in touch.
Thank you. Thanks, everybody. Goodbye.
Bye.
Thanks, welcome back. Thanks for staying tuned for our tip, because ToRAISE has a really good one today.
Well, first I want to just say that was a really interesting conversation with Lynn, and we will have her back at another time, because she has so much information, and I had questions still just based on things that she was saying, and I'm really interested in some of the other topics that she covers as well. But we will do that, and we hope you guys will spend some time looking into her information and others who work in pelvic health. So yes, I have a tip. It's a pretty simple one, but I think it's really useful. This was actually given to me by a chef probably 10, 15 years ago about body odor. And we know that when we're at a birth, that a woman in labor has a very keen sense of smell. All her senses are really heightened. And what we want to be really careful is that they not smell our body odor in any way. You'll probably smell theirs, but you do not want to be they do not want to be smelling you. So if you are at a labor and you're feeling like, oh my God, I'm getting a little stinky here, go over in every hospital room, there is the hand sanitizer. Squirt a little into your hand, rub it into both of your armpits, and bam, you have cleaned and have deodorant.
Love it.
Yeah, well, it's alcohol primarily. It kills the germs. It dries everything up, and that's it. And here, I'll give you the other tip. You don't have to buy deodorant anymore if you're okay using hand sanitizer, because it really actually works really well. So that's my tip. Thanks, everyone.
Thanks for listening.